Hello everyone, this is Raviteja and today we are going to see about the topic of growth. This video is presented by MEDeaze and MBBS freaks. The objectives are growth definition, loss of growth, factors affecting growth, anthropometry, normal growth pattern, growth charts and interpretation. What is growth? Growth denotes net increase in size or mass of tissues. This occurs by multiplication of cells and increase in intracellular substance. There is another term called development. Development is maturation of functions. It occurs by myelination of nervous system. For example, let's take a child. The child is growing in height. This denotes growth. A child is able to run. This denotes development. So growth is when there is an increase in size or mass, and development is when there is acquisition of skill or function. The loss of growth. There are three laws. First one is growth is cephalocaudal. That is, growth occurs from head to toe. The second law is distal to proximal. For example, let's take the upper limb. The growth occurs from fingers to the proximal part of the limb, that is distal to proximal. The third law is different tissues grow at different rates. Let's see brain growth. So the brain growth occurs in early period. That is, it reaches 90% of adult weight by 2 years. So brain growths occur in early periods. Conversely, the gonadal growth occurs in puberty. First, there is gonadal growth is stagnant, then there is increase in puberty. Somatic growth, first there is increase in the growth, then a plateau phase occurs, then exponential phase occurs in puberty. Lymphoid growth occurs between 4 to 8 years. It is more than the adult size between 4 to 8 years. So growth of body fat and muscle mass. Body tissues is divided into fat and fat-free components, that is lean. So fat component is more in girls than boys. Fat-free or lean component is more in boys than girls. This is after puberty. Skeletal growth. Skeletal growth stops when there is a fusion of epiphysis with the shaft. In females, it occurs at 18 years. In males, it occurs from 20 to 22 years. So that's why males are more in height than females, on average about 13 centimeters. Factors affecting growth. The growth is affected by various factors in three different periods. First is fetal growth, then postnatal period, and social factors. In fetal growth, we can remember by three components. First is fetal, maternal, and placental. The fetal factors are genetic potential, sex, fetal hormones. So, genetic potential. There is a correlation of maternal weight and height with the birth weight. There is a maternal constraint that how much a baby should grow so that the mother can deliver the baby. Sex. The boys are more in weight at birth than girls. Fetal hormones. There are hormones which are responsible for fetal growth. Insulin, insulin like growth factor 1 and 2. Insulin is released by pancreas, fetal pancreas. Insulin like growth factor is released by placenta. These are necessary for growth of fetus. The other factors like hormones like thyroxine is necessary for neurodevelopment. The maternal factors like teenage pregnancy or advanced age, anemia, obstetric complications like eclampsia, preeclampsia, pregnancy-induced hypertension. These all results in growth restriction of fetus. The placental factors. So the fetal weight is directly proportional to placental weight at term. There are certain changes in the placenta that helps in more efficient adaptation. That is increased total villus surface area, decreased diffusion distance, decreased resistance in vasculature, dilatation of fetal capillaries. These adaptations help more diffusion of nutrients from the placenta to the fetus. This helps in growth. In postnatal period, the factors affecting are genetic, intrauterine growth retardation, hormones, sex, nutrition, infections, and trauma. Genetic. Some genetic disorders results in short stature like Down syndrome and Turner syndrome. Some genetic disorders results in tall stature like Klinefelter syndrome. IUGR leads to low birth weight. That leads to stunting, wasting. Hormones like growth hormone and thyroxine are very essential for the growth of the child. 6. Growth spurt occurs earlier in females than males, but the overall height of the boys is more. Nutrition, protein energy malnutrition, anemia, vitamin deficiency, these all results in decreased growth and development. Infections, persistent diarrhea. Persistent diarrhea causes decrease in height of the child. Trauma to the epiphysis causes decrease in the height. Social factors like socio-economic level, poverty, natural resources, climate, emotional factors, cultural factors, and parental education. The child belonging to upper economic level have better nutritional status. A child with poverty goes through hunger, undernutrition, and infections. The climate, the growth is higher in spring and low in summer. Emotional factors. A child from broken homes or orphanages do not grow optimally. Cultural factors. There are certain cultural factors regarding the child rearing, parental education. When the mother is educated, there is more health promoting behavior. Anthropometry. Anthro is human, metry is measurement. So the measurement of the human is known as anthropometry. First is weight. To measure weight, first we have to make the baby nude or with minimal clothing and placed on beam scale for weight. This is the first method. In second method, we have to weigh the mother along with baby and weigh the mother separately and subtract the mother weight from the overall weight. This gives us the baby weight. Length or height. When the child is below 2 years, we measure length. When the child is above 2 years, we measure height. Length is measured by infantometer. Height is measured by stadiometer. For measuring length, we have to keep the baby on the infantometer. Head should be attached to headboard. The baby should lie supine. Eyes should project perpendicular to the board. We have to bring the footboard to the foot and length is measured. For stadiometer, the child should stand upright. Heels, calves, buttocks, back, and head should touch the stadiometer, and the child should see along the Frankfurt line, that is the line joining the external auditory meatus and lower border of the orbit. The headboard should move down and the height is measured. Head circumference. Head circumference is measured around supraorbital ridge and external occipital protuberance with non-stretchable tape. Chest circumference is measured at the level of nipples in between inspiration and expiration. Midarm circumference. For measuring midarm circumference, first we have to measure the length between acromion process and olecranon process. At the midpoint, we have to measure the midarm circumference. Anthropometry is divided into age-dependent and age-independent anthropometry. The age-dependent anthropometry is height, weight, BMI for age, head circumference, and chest circumference. The age-independent anthropometry are weight for height, mid-upper arm circumference, and skin fold thickness. These three are age-independent anthropometry. Skin fold thickness is measured by Harpendens caliper, as you can see in the diagram. It is measured at biceps, triceps, and subscapular regions. The value of greater than or equal to 10 mm is normal. The value less than 6 mm is abnormal. Normal growth pattern. We shall see the normal growth pattern in relation with various anthropometry. First is weight. The birth weight of a baby is 3 kgs normally. Then he loses 7 to 10% weight in first week. At 10th day, he regains the birth weight. Then the baby grows at 20 to 40 grams per day up to 3 months. Then from 3 months to 1 year, the baby grows at 400 grams per month. The baby weight doubles at 5 to 6 months, triples at 1 year, quadruples at 2 years. For 3 years, the weight is 15 kgs. For 4 years, the weight is 16 kgs. Length or height. At birth, the normal length is 50 centimeter and it doubles by 4 years, that is 100 centimeters at 4 years. At 6 months, the length is 65 centimeters. At 1 year, the length is 75. At 2 years, the height is 87 centimeters. At 3 years, the height is 95 centimeters. Head circumference. At birth, the head circumference is 34 centimeter. Then the head circumference grows by 2 centimeters per month for first 3 months. Then 1 centimeter per month from 3 to 6 months. Then 0.5 centimeter per month from 6 months to 1 year. Chest circumference. Head circumference is greater than chest circumference at birth by 3 centimeters. By 1 year, head circumference is equal to chest circumference. Later, chest circumference will be more than head circumference. BMI is body mass index. It is weight in kgs by height in meter square. Growth charts. There are two types of growth charts. They are WHO and IAP. The WHO growth charts are based on MGRS, multicentric growth reference studies. The WHO charts are used for children below 5 years. IAP charts are used for children between 5 to 18 years. The WHO charts are different for boys and girls. For boys, it is blue in color. For girls, it is pink in color. The normal variation. How can we know that while plotting the child is normal? The anthropometry of the child is normal. That is, we measure by three components: percentile, standard deviation, or Z score. When the child lies between third and 97th percentile, it is normal. -2 standard deviation to +2 standard deviation, it is normal. -2 Z score to +2 Z score, it is normal. Let us see an example. So here we are taking weight for age WHO chart for boys. In first scenario, 2-year-old boy of 8 kgs. So how to plot? So here we have to see 2 years in this way. Then weight is 8 kgs. 2 years and 8 kgs. Here we are plotting it. See, the third center line is this, 97th line, center line is this. So the baby, when the child lies between these two centiles, that is normal. But here, this child is below third centile, that is, he is underweight. In second scenario, 4-year-old baby of 16 kgs. So we have to plot at 4 years and 16 kgs. In this case, the child lies between third and 97th centile. So this child is normal. The first child is underweight. In this way, we have to plot in the growth charts. Interpretation. So after plotting the growth charts, we have to come to certain interpretation. There are three components: weight for age, height for age, and weight for height. When the weight for age lies -2 to -3 standard deviation, that is when the weight for age is decreased, it is known as underweight. When it is below -3 standard deviation, it is severe underweight. When the height for age decreased, it is known as short stature or stunting. When it is below -3 standard deviation, it is severe stunting. When the weight for height is decreased, it is known as undernutrition. When the weight for height is increased, it is overnutrition. When the weight for height lies between -2 to -3 standard deviation, it is known as wasting. When it is below -3 standard deviation, it is severe wasting. When weight for height lies plus in between +2 and +3 standard deviation, it is known as overweight. When it is above +3 standard deviation, it is obese. When according to BMI, the overweight category is equal to 23 adult equivalent and the obesity is 27 adult equivalent according to BMI. Height for age decrease indicates chronic malnutrition, that is stunting. decreased in weight for height indicates acute malnutrition, that is wasting. Thank you all.